Hello, thank you for joining us. My name is Janet Rich Edwards, and I'm an epidemiologist at Harvard Medical School and the Harvard Chan School of Public Health, as well as a faculty advisor at the Radcliffe Institute for Advanced Study that's organized today's program. Thank you for joining us in this discussion of domestic violence during COVID-19, part of the collateral impact of this pandemic and our response to it. Today's program is part of a series by the Radcliffe Institute, which reflects three critical elements of the Institute's mission. First, it reflects Radcliffe's commitment to examine and address pressing issues facing our society, a commitment which is at the center of our strategic plan, Radcliffe Engaged. Second, it reflects our commitment to cross-disciplinary research and our conviction that insights from across disciplines can advance public discourse and identify innovative solutions to complex problems. Third, this series reflects the Institute's commitment to equity and opportunity. We know that COVID-19 disproportionately affects vulnerable and marginalized communities, including those in the streets protesting today for justice. Together, we have a responsibility to examine the deficiencies that this crisis has revealed and exacerbated, and to help chart a more equitable way forward. This discussion is one part of that effort. Today, we explore a deeply disturbing trend associated with COVID-19. In communities across the country and around the world, we've seen spikes in child abuse and intimate partner violence, as reported by hospitals and crisis hotlines. In some places, this is accompanied by a troubling decrease in police reports of domestic violence, which may reflect any number of factors that we'll discuss in this hour. The current situation, with its heightened household isolation and stress, is a tragically perfect storm for exacerbating already abusive relationships, which are common, as well as creating the condition for newly abusive situations for adults and children alike. We know, for example, that when unemployment rises, so does child abuse. The public health guidance to stay home to prevent the spread of coronavirus has made it even harder for individuals experiencing violence to find safety and care. Shelters, social workers, and court advocates have all had to curtail services or change and pivot to remote services. It's much harder now to leave home, particularly with children, to stay with a friend or with grandparents. Hotlines are reporting calls by individuals asking which is safer, to stay at home with an abuser or go to a shelter and risk infection. The community that provides a safety net in the best of times is strained, but trying to find new solutions. We'll talk about that this hour. We're joined this afternoon by a panel of experts in health, law, and social services who will discuss strategies to meet this urgent need. Jacqueline Campbell is a professor at the Johns Hopkins School of Nursing, where she holds the Anna D. Wolfe Chair and serves as program director of the Robert Wood Johnson Foundation Nurse Faculty Scholars. Sharon Imparato is the director of clinical innovation projects and training at the Boston Area Rape Crisis Center. Nina McConico is a clinical psychologist and program director of the Child Witness to Violence Project at Boston Medical Center. And Melissa Dubose is an associate judge of the Rhode Island Judiciary District Court. Before we begin, let me give you a quick overview of today's format. First, we'll hear from Professor Campbell, followed by Director Imparato, Dr. McConico, and Judge Dubose. After their remarks, I'll moderate a brief conversation among all the speakers. We'll save the last 20 minutes or so of the program to respond to questions from the audience. We encourage those of you watching today to use the Q&A feature on the bottom panel of your Zoom there to submit your questions at any time throughout the program, and we'll respond to as many as we can. I also want to point out that there are resources that are already posted in the chat for those who are seeking support or experiencing violence now. And now I will turn it over to Professor Campbell.
First of all, I want to say I'm delighted to be here and that this is an incredibly important topic and week in our history that 2 weeks in our history that on top of COVID, I think we have to be incredibly mindful. And I always talk about the trauma trails in our community. And those trauma trails include historical and structural racism. And we also have now COVID. So that when we think about how this may affect women who are abused, which is the area of research that I've been in for many decades now, I have been forced to re-examine how structural racism has affected our communities and also the entire issues around domestic violence. So we know with COVID, we have families that are in isolation. Many have the death of loved ones, or even the death of ones they do not know that are in their neighborhoods from COVID. The uncertainty of employment and income, the stress for many families of being in a small place with multiple people day after day. If people have children at home, there's homeschooling to deal with, dealing with their anxieties. And if they have witnessed domestic violence in their homes or have had a lot of adverse childhood events, especially if it's in neighborhoods where they have experienced violence and structural racism, many times people are in a home with a partner who has had this cumulative trauma. And one of the things we know now that we didn't know 30 years ago when we first started dealing with domestic violence is the issues of brain science. And that when people are triggered, the response of someone traumatized is oftentimes anger. And if the frontal cortex, where we usually decide whether or not to hit somebody when we're mad, is not engaged, which is what we've learned from brain science happens to people who have been highly traumatized as children, the result can be violent behavior, and violent behavior that they honestly did not mean to do. And I think that's been missing from our discourse on domestic violence in the last 20 years. We've only started to think about the last 5 at most. And the over-policing and unequal justice is true in relationship to domestic violence also. And it contributes, one of the things we have to think about is that when women make the decision whether or not to call the police if they are being abused, that these issues that are now front and center for all of us, but have always been front and center to African-American women, is that they may be very reluctant to call the police. And all of us are trying to process these horrific images of violence against Black men. And we need to be very mindful about how this intersects with our attempts to decrease domestic violence. And because when women are thinking about whether or not to call the police, if you're a white woman in America, you're seeing the police as being helpful. If you're a Black woman in America, you realize that Black men are held more accountable, quote unquote, in our domestic violence parlance than are white. Everything from bail to incarceration. Now, theoretically, what we know about intimate partner violence, domestic violence in the time of the pandemic, we do have some anecdotal evidence of horrific intimate partner violence, but it's mostly anecdotal. Don't have very much systemic, population-based, reliable data from across the country about what's happening. There's uneven evidence of both increased calls to domestic violence hotlines and decreased calls and domestic violence calls to the police. And as I mentioned, part of those, whether or not there's increased domestic violence to the police, depends on where you live and what color is your skin. Now, many couples are reporting fighting verbally and saying nasty things to each other in this time of increased stress of COVID. But a person, if not highly traumatized as a child and not having been abusive to a partner before, is unlikely to suddenly become violent for the first time. And even if some physical violence occurs for the first time, that couple is unlikely to define it as domestic violence. But existing domestic violence may well happen more and worse. And there is some evidence of increased intimate partner homicide suicide, not homicides without suicide, but homicides when the partner kills, and it's usually a himself afterwards, through a comparison of newspaper reports from March and April of 2019 compared to March and April of 2020. And Casey Gwynn's been doing that. My place where my research has come into play is in the danger assessment, which was developed way back in 1985 to increase abused women's ability to take care of themselves. It's an instrument that helps women accurately determine how much danger they are in from homicide, from an abusive partner. It's interactive, it uses a calendar, it's very much around the voice of a person who's experiencing violence. That calendar aids recall. It's very important to do the calendar with it. The danger assessment website is up there. The danger assessment is available for free for anyone. I oftentimes get women accessing the danger assessment, filling it out and sending it back to me and saying, so what does this mean, lady? And the DA5 is a short form of the danger assessment for the healthcare system. The danger assessment for immigrant women is available. The DAR is for women who are in a relationship with another woman. Now, when we think about COVID, what's on the danger assessment that may reflect this increased danger and increased risk for a homicide suicide? Is he unemployed? Is one of the questions. And nowadays I think about, so what's the so what on that in terms of when we do safety planning with women based on the danger assessment? If he's unemployed, if that increases the danger of him killing her, then we need to provide employment opportunities for abusive partners. Thus far, we do not. We don't have really good job training. We don't have that employment. So that's sort of new thinking that we need to think about, both in the intersection of COVID and the recognition of the structural racism in our systems. The other one is, has the physical violence increased in severity or frequency over the past year? And has COVID contributed to this? That may well be an issue. Is he an alcoholic or problem drinker? Alcohol does not cause domestic violence. It does make things worse. Does he control most or all of your daily activities? Now, this is the far end of the continuum of controlling behavior, but COVID may give an abuser the opportunity to control her even more so, because she's stuck at home. She may not have the ability to interact with her coworkers, et cetera, and so forth. And in these days of electronics, there's a lot of electronic surveillance that abusers can do. Now, has he ever threatened or tried to kill himself, to commit suicide? Now, ordinarily in domestic violence parlance, we think about that as he's trying to manipulate her, or he's trying to control her more so. But actually, our deeper understanding of trauma means that he needs interventions for that suicidality as well as for the domestic violence. It needs to be part of our interventions for suicidal abusers, that we can't ignore it, because he will take her with him if he's abusive and kills himself. So that's one of the things that we need to think about differently. And the men who commit homicide, suicide are more likely to be white. So in our criminal justice system, oftentimes they have never been arrested for domestic violence. They have never been held accountable. They've been able to expunge their records, which is something that white men, especially white men with resources, are able to do. Does he threaten to harm your children? And does he follow or spy on you? That electronic kinds of stalking that abusive men may do. And I wanted to mention My Plan, which is an app which is available for women. It does not scream out, you have to be abused to use it. You have to admit that you're in an abusive relationship, because many couples are not thinking that way. It does have the danger assessment built into it. It's got all kinds of safety strategies in terms of safe usage built into it. You have a PIN code, and if you put 0000 into it, it goes to a screen that is totally non-abuse related. And it also personalizes safety planning. It does not take the place of a good domestic violence advocate. We always say call the National Domestic Violence Hotline. We also say if you're in high danger, do call the police. However, it also, if she wants to stay with him, it gives her safety strategies for staying in the relationship and trying to make things work. So it's very much personalized. It's very brilliantly programmed by Nancy Glass, my colleague, and James Case are the ones that developed it. And that website is there, and we'll have it on the resources. So personally, in June of 2020, my personal resolve, and I think all of us need to, is examine and confront the structural racism that's in all of our systems. I'm a nurse, it's in the healthcare system, it's in my university, I'm an academic, my research, and I have to do that with deep cultural humility. And our domestic violence systems, are we holding Black abusers more accountable? And are we failing to recognize that women, Black women who are being abused are very distrustful of calling the police? How do we reach out? Any of you that saw 60 Minutes last night might have noticed how Black abused women are more often jailed because of quote unquote failure to protect, far more than white women would have been. So we need to think about those things. And I personally want to work on becoming an agent of healing. So thank you very much. This is a quote from Brian Stevenson. Oh, and I'm supposed to pass this along to Director Imperato.
Thank you very much. Thank you, Janet, and thank you, Professor Campbell, for all of your comments, through very comprehensive comments about all the things we need to consider and address today. So I'm going to say ditto, and I'm going to add an and to this. So my name is Sharon, and I work at the Boston Area Rape Crisis Center, and we focus on providing services for people who've experienced sexual violence throughout their lifetime, as well as their partners and friends. And so I want to make sure that we understand that sexual violence impacts everyone and can be perpetrated by anyone. So we're talking about all types of survivors. And I want you to know that you're going to get the information for BARC a little bit later on, but I want to let everybody know that BARC is fully operating 24/7. We're doing everything remotely, and we're hoping to meet the needs of survivors by doing all of our services remotely. So BARC is here, and I want to remind people of that, because as we're thinking of COVID and getting services, it does require a lot more planning and a lot more thought on us as providers and for survivors to think about what they need. And so I wanted to offer BARC as a resource as well. Next slide, please. Thank you. So I'm here to talk about sexual violence, and I know the topic is domestic violence, intimate partner violence, but I want everyone to understand that sexual violence can be a component, and most often is, of domestic violence. It might be that component that's not necessarily as often talked about or thought about, just because of all the things that go along with sexual violence and people's ideas around sexual violence. And so sexual violence can occur within a domestic violence relationship, an intimate relationship, or outside of that. And so just want to have consideration. It can be child sexual abuse. It can be of a family member who's not intimate in the household or at work. And I think particularly if people in the service industry are at higher risk of experiencing sexual violence at work. And I want to acknowledge that a lot of those people are considered essential workers. And as we think about opening up, what that's actually going to look like and the risks that they might be having and increased risks of sexual violence. So I want us to pay attention to that. Next slide, please. So thinking about sexual violence and what that looks like now, we are and will see, I'm going to say in the future, an increase of child sexual abuse because kids are at home more, as our family members and other people in their lives are at home. So there's a lot more access. And also we're in a time right now where people are feeling out of control. So sexual violence, again, can be a part of domestic violence, intimate partner violence, and that sexual harassment towards workers are being experienced as well. And we have to think about also all of those policy changes that were coming up and how they've been sidelined because everyone is focusing more on COVID right now and thinking about that and the impact it's having on people's ability to report or to know what they've experienced is sexual harassment. More online cyber stalking and harassment, definitely seeing some of that. And we have to be really thoughtful about the idea that we may not be seeing reporting now for incidents that are occurring now, because people have to be really thoughtful about what their basic needs are and have those needs met first. And so they might put off disclosure or reporting a little bit later on. I'm talking reporting to friends, hospitals, police, all those avenues of reporting, and may not be talking about it right now as they think about what's most important for them in these moments. And those are basic needs: food, housing, and shelter. And safety of other people as well. And so I want us to be thoughtful. We might actually see disclosures months from now to years from now. And I want us to pay attention to that because you may not be hearing the disclosures now. It doesn't mean that it's not being done. And so I want us to pay attention to that. And then also thinking about the impact that COVID is having on people who experience sexual violence previous to COVID and the impacts that it's having on them and how they might be worsening. Next slide, please. And so some things to consider whether someone experienced sexual violence during COVID or previously is the idea of isolation. And isolation is an ongoing impact for survivors. And so with COVID and the need to be in your house or isolated even more for safety reasons can be really difficult and really re-triggering for a lot of people. And I want to add it's isolation and or feeling isolated because it's important to recognize what someone's experiencing in their situation and not for us to decide that for them. So it's about being at home and during the stay-at-home orders or going to work on the empty streets or feeling as if you have to stay away from your coworkers can feel very isolating as well. And if you're in a multi-generational household, the need to want space and not being able to communicate builds resentment, which builds disconnection. And so recognizing isolation can come in many ways. And then the idea of safety. Safety is important for survivors. And I want you to remember that survivors are constantly navigating safety for themselves, and it's something that they have. It's a resiliency, I think, as providers we have to rely on, and it's a resiliency of necessity. So I want to make sure that that is heard, but it's something that we have to recognize that survivors have the ability to make decisions. We want to be thoughtful about empowering when it comes to that. So when it comes to safety, it's recognizing they're constantly navigating that. Adding a layer of feeling unsafe because of COVID, either because you're in the home with your abuser or you're at work and there's less people around and you're being abused at work, or you're someone with a disability who is in the home and being with an abuser, and then the added stress of COVID and there's no relief and no opportunity to reach out. Also thinking about communities of color, low-income communities and immigrant communities, and how sexual violence and COVID disproportionately affect these communities because there's a lack of access to resources. And so I want us to be thoughtful of all of these things because we have to recognize the barriers and dismantle those. And there are barriers of racism, there are barriers of COVID, ableism, and many others. I attended a webinar last year, and Zoe Flowers was one of the speakers, and she was from the Women of Color Network. And she said to me, which I thought was really powerful, not to me, I felt it to me, but it wasn't to me directly, that survivors don't have barriers. Institutions have barriers, systems have barriers, and we as providers have barriers. It is then up to us to be aware of those barriers and to dismantle them so that we can provide as many opportunities for accessible services as possible. So what we need to be doing right now is to provide as many opportunities to reach out, whether it's through web chat, whether it's in person, whether it's on the phone. Like, what are the opportunities for survivors to reach out and get services, and providing those. And we have to be thoughtful about the options may not be great. They may not be completely safe, but the survivor has to decide for themselves what's safe for them in any given moment. It's up to us to then be there. So I think it's also about empowerment and choice. And so I wanted to let everybody know that that's sort of the plan moving forward. Next slide, please. And so just again, to be thoughtful about basic needs. I work at a rape crisis center, but people are coming to us more to focus on wanting help with food, housing, and financial security. And so we have to be really thoughtful about meeting those needs first before getting into the trauma. And can we do both? And I think for all of us, it's being able to be aware that domestic and sexual violence is occurring, and they have these basic needs, and we have to be addressing both and making sure we're asking about both. So I wanted to thank you very much for listening, and I'm going to pass it off to Dr. McConico. Thank you.
Good afternoon, everyone. Thank you for having me here. As I said, I work for the Child Witness to Violence Project, which is a program at Boston Medical Center focused on working with young children and their caregivers between the ages of birth and 8 years old who have been exposed to violence or some other kinds of trauma. And I'm really here today to offer the perspective of working with children, and also to think about a framework to kind of guide our prevention and intervention efforts for young children and families who've been impacted by violence. Next slide, please. So what we have learned at the Child Witness to Violence over the many years that we've been doing this work is, number one, that children of all ages are impacted by violence exposure, and that is from in utero all the way through their adolescence and young adulthood, and that it even can have implications for their adult life moving forward. And that domestic violence is a particularly toxic form of trauma for children because it really occurs in the context of those caregiving relationships in which we are supposed to be able to have a sense of safety, learn about trust, and kind of get our cues about what is helpful in the world, what isn't. And so when we have things that are happening in the home that can be particularly scary, or when they are not safe, it can really be anxiety provoking for young children. It can cause a sense of confusion for them, and it really can be disorienting for them. And as my colleagues have already noted, we too, I think I would be remiss if I didn't mention the backdrop of some of the systemic racial and social inequities in which we find ourselves before COVID, but even now so while we're in the midst of COVID, and just thinking about all of the events that have transpired in our country over these past few weeks, and that these social categorizations like race and class and gender, that they really impact one's experiences, they impact who has access to services and who doesn't, and they even impact the ways that individuals get treated by those very systems that are kind of meant to serve and protect them. And lastly, that working with our most vulnerable children in our society really impacts us as providers, us as helpers, and can really change our world perspective, as well as creep into our daily interactions and causing us to also feel a lot of anxiety and stress. And I'm hoping that we'll be able to bring that into the conversation today. Next slide, please. So given all of that and what we know from some of the science and the literature that we have available to us, that kind of in terms of best practices, we really ought to be shifting the way that we are thinking about this work from a more individualistic point of view to thinking more holistically and more relationally. And so recognizing that we all come into every relationship or every interaction that we have with a set of preconceived notions and biases and assumptions about the rules of engagement, if you will, that kind of dictate how we think folks ought to be in relationship with each other and how we think things should roll out and play out in society. And that these are kind of operating underneath the surface for us, but are most definitely driving some of the way that we respond and the ways that we might react when we find ourselves into these situations. And so we are bringing these to every relationship that we have. And that we have to really think and make sure that we have mechanisms to be able to keep these underlying assumptions and biases in check, and that we know how to increase our awareness of them. Because if we don't, we risk causing some harm to the families and the children that we are working with. And so an example, so when we judge a caregiver for either not filing a restraining order or not calling the police after a particularly violent episode has happened, we could be making an assumption that she or that person is choosing their partner over the safety of their child. And without giving consideration to some of these other social political underpinnings that might be at play, as my colleagues have mentioned, but also we may be making that decision in the absence of any kind of comprehensive evaluation or assessment about safety that isn't grounded in any evidence-based practice. And so if I could highlight one thing, I can't say enough how important it is for us to be able to have within our institutions and within our own practices this mechanism to really help us think reflectively ongoing about the work that we are doing. Next slide, please. So we know that domestic violence exposure for young children is really prevalent. I would say we have a public health crisis where we have 15.5 million children living in families in which DV has occurred. We also know that there is a correlation between domestic violence exposure and child maltreatment, making children at increased risk of serious harm and even death in some instances where they may find themselves trying to intervene in when one caregiver is being violent toward another, or as Professor Campbell had pointed out, in some of these more egregious incidences where we have more murder-suicides that may happen. Next slide, please. And so, at Child Witness to Violence Project, we work primarily with young children between the ages of birth and 8, and I would say that this is important to bring into the conversation because we know that young children, particularly from birth to 5 years old, that they are more vulnerable to the physical and psychological effects of trauma, and domestic violence exposure most definitely could be classified as a potential trauma. And that these chronic experiences make them more susceptible to developing things like depression, anxiety, and some challenging behaviors that are going to impact them across their development as well as their physical health. Next slide, please. And so it's really important that we take all of the current science and the research that we have available to us, and we take that and we put it into context so that it's really kind of helping to drive any kind of intervention and prevention efforts that we are trying to raise up in our various roles. And so we know that chronic violence exposure, particularly for children, and I would say more so now than ever while we're in the midst of COVID, that it really impacts one's ability to feel safety, feel to know kind of who they can trust, feel a sense of trust in the world, feel a sense of trust in those around them, and it also impacts one's ability to feel a sense of power and control or sense of agency. And I have this healthy attachment piece in the middle here because that is really the glue that kind of holds it all together, and that we learn these other concepts or these constructs in the midst of or in the context of those positive, nurturing, kind of early caregiving relationships that we have, which is another reason why it's really important for us as we are thinking about the work and moving forward that we think more relationally and we think more holistically in terms of family units. Next slide, please. And so in conclusion, I would say that, again, all of our prevention and intervention efforts, so not only should they be taking those 4 constructs that I just mentioned into account, but we also should be thinking about initiatives that are going to increase protective factors that will ultimately reduce or help to mitigate some of those more negative neurobiological impacts of trauma exposure. And that will ultimately increase resilience for the children and the families that we are working with. And now I am going to turn it over to Judge DeBose.
Good afternoon. It is such an honor to be here today. Thank you so much. I'm going to begin with a quote that struck me. It's from Zaida Hernandez, who's a member of Sisters Overcoming Abusive Relationships. And I just want to go through this with you because I think it really speaks to the heart of the stress and the realities that people who are facing domestic violence on a real day-to-day basis. So she noted that now all of a sudden the normalcy, or the only normalcy that you may have had to go to work, to go to school, is taken away from you. When do you have the opportunity to call when you're locked up in the house with someone abusive? How do you reach out? How do you get out of there? Where's a safe space? I've never had to live through something like this COVID-19, but I recall some snow days or when her abuser was sick and the torture I would go through when I was stuck in the house with him. This is 10 times worse. And I think that there are many survivors and folks who are experiencing domestic violence who would echo those words. Just by way of numbers, in Rhode Island, in the month of April 2020, there was a 40% increase in helpline and hotline calls. Of these calls, 56% of them led to housing referrals. That's a 9-fold increase over 2019. In terms of the raw numbers, there were 599 helpline callers in the month of April who requested emergency shelter. And in Rhode Island, like in most states, there just certainly is not the capacity or the space for those folks that need help. When we look at all of the individuals that are out there looking for in need of help in housing, we had the homeless population. There was a call to arms. Our local hotels stepped up in motels to have space for them. We had folks that were ordered through mandatory quarantine who needed a place to go. So there was units and assets that were taken to support them. Certainly there were first responders who needed a place to stay, so they weren't bringing home COVID to their families. And so then you have the folks who are experiencing violence at home who are looking for a place to stay, and those assets just aren't there. So I'm going to truncate my remarks just a little bit because I'm cognizant of the time and I know that there are folks who have some questions. I sit in Kent County in Rhode Island, and I sit on a hybrid calendar, both civil and criminal. And in both instances, I see how the no contact order or the protective order in the civil context is being stressed in the era of COVID. So I'm going to briefly just describe how those dual systems work and how in particular in the civil context, it's more problematic. When you think of in the criminal context, there's an abusive act or a crime is committed. The police, law enforcement shows up, they take a statement. If there's probable cause, the defendant is going to be arrested, they're going to be arraigned, and they're going to be set out on bail. When bail is set in Rhode Island, I'm sure in most jurisdictions, there is a no contact order that's in place at the arraignment. That defendant is responsible for getting out of the house. It is not the responsibility of the complaining witness, it's the responsibility of the defendant to leave the home. That's in the criminal context. In the civil context, it's quite different. A civil protective order, the plaintiff or the person alleging the abuse has to come into court. They fill out a cover sheet, which establishes jurisdiction, and then they fill out an affidavit that has to outline all of the conduct that they believe rises to the level for the court to intervene and enter a protective order. There are 2 elements of it. One element is the no contact. For the purposes of this discussion, the second element is the vacate order. So this court, if we're satisfied, could ask a criminal defendant, a civil defendant, to vacate a home. But there is one caveat. In Rhode Island, if the alleged abuser is the sole owner, if their name is on the lease, but the complaining witness is not on the lease, the court has no jurisdiction and cannot ask that abuser to vacate. So in the era of COVID, if someone comes into this court and they seek a protective order and we're unable to order a vacate, for them, it's worthless. It doesn't do them any good. And so there's a lot of thought going into changing that element of the statute. We're not there. So as we sit here today, of all the folks that are coming into our court, some of them are getting the requests and the protection that they need. Others certainly are not. The one good thing that we have in Rhode Island, unlike other jurisdictions, we do ask that all criminal and civil defendants who are under protective orders to surrender firearms. And I know that that's a controversial topic in a lot of jurisdictions, but certainly that's what we do. I want to just show, if we could throw up an affidavit, and I want to talk to you about what it looks like for judges when someone comes in, and I mentioned you come in and you fill out an affidavit and you attest to the conduct that you're being alleging is being abusive. When you look at the form itself, the first thing that should strike you, or that strikes me, is just how antiquated this form is. You have tiny box, so someone's coming into court, they can have a pen, and you're squeezing in, and you're using this space to capture what behavior is going to be significant to warrant the judge to grant what you're looking for. And so for a whole host of social reasons, this form in itself can be very problematic. I'm not going to go through the form because there is some real sensitive language in there, but I want you to take note of one thing. The very last line on this left half of the slide, it says, as told to me by a domestic violence advocate. So here's an advocate who sat down with a petitioner, took her words, it was a female in this case, and then captured that material, and then that comes before the court. During the age of COVID, while the courts are open and anyone can come into this building and fill out this affidavit and a judge will hear it, the advocate's office was not open. And as of today, I believe there's kind of smatterings coming back in. So what that does is it leaves a gap. So many people coming in who are attempting to use this device in this vehicle, if they don't have the court resources around them to fill it out, it makes it all the more difficult. And again, if the relief that they're seeking in the civil context is a vacate and the court can't do that, that leaves a whole cohort of victims who are stuck. So that's just something that I think that we need to think about. Again, I could go on and on and on. There are so many complex elements to this and aspects that we face in the judiciary, but certainly I am looking forward to the discussion and furthering the conversation.
Thank you, Judge DuBose, and thank you to all our panelists. I now get to moderate a discussion amongst our panelists before we open up to questions from the audience. So I encourage you to submit your questions through the Q&A function that's at the bottom of your screen. I'm going to have to speed read those in real time, so it's very helpful to me if you can keep those questions short so you can watch less of me reading them and get to hear more from our experts. I'll try to get as many as we can. So to start, I'll do a bit of a lightning round. To hear from each of our panelists, what novel programs have you either initiated or heard about or would love to see to respond to this issue during the pandemic? I'm aware, for example, that in San Francisco, you can now text 911 instead of just call 911, which I think is helpful in close quarters. I understand in Chicago, Lori Lightfoot, the mayor, has collaborated with Airbnb to make hotel rooms available to people suffering domestic abuse. So I'm wondering what you guys are seeing out there. Sharon, why don't I start with you?
I don't know if it's necessarily novel, but definitely out of necessity that we've really realized how doing virtual services can be accessible for a larger number of people. So thinking about being able to do it on video or do it on the phone. BARC also has a web chat hotline. So that's also been really wonderful and great for particularly survivors with disabilities. And so just recognizing how much more accessible we can actually be if we venture into the virtual world, which I think a lot of us are afraid of doing, particularly doing one-on-one services. And I think that has been something really great. And I can't necessarily speak to what our case managers, for example, are doing when working with survivors who do have insecurities around finances, food, and shelter. And so for them, as they use any trick in the book that they can to help meet the needs of the survivors. And so trying to utilize all resources as possible.
That's great. Jackie, how about you?
Well, our fabulous House of Ruth Maryland has also collaborated with hotels, so they do have housing space available for abuse victims. And they're keeping the shelter, being very careful about bringing people into shelter and in terms of testing for COVID, et cetera, which has to be part of the thinking. We're also working with the police around how they respond to domestic violence calls. And there's a lot of different discussions around how we do this in a way that for women who are seriously abused, who are in fear of their lives, don't feel afraid to call the police in this time. And that really is a challenge, but we're talking about trying to develop more trauma-informed interventions for people who use violence against partners that are less dependent on court mandates and more available to people and their partners who are using violence. And the Strength at Home intervention in the VA is available at every VA, and it has been RCT tested and shown to both decrease PTSD, so whether the PTSD is from combat exposure or from a childhood exposure to violence, and reduce the use of violence against partners. And we need something like that in the civilian world, but meanwhile, it is available at every VA in the country.
Great. Thank you for that, Jackie. Judge DuBose, how about you? What innovations would you like to see or have seen?
Well, I think the one thing, just going back to that affidavit, that I would think more user-friendly court forms and access to online materials for the pro se defendant. When people are coming into the court and they don't know what they need to do, so to have an advocacy group that's there all the time is considered an essential worker. So while we have defense attorneys here, the attorney general is here, obviously we have our sheriffs, we have our judges, we have our clerks. I think that we should have a cohort of court interpreters and, more importantly, domestic violence advocates to help navigate those forms. And what even better is to have a digital kind of laptop or pad where they can type in that information. It's very difficult to fill out those forms, but to be able to kind of sit down in a safe space in the courthouse and type out and really reflect on the conduct, because you have to satisfy the judge. So you want to make sure that you're capturing everything. And sometimes I don't think you can do that when it's rushed. So I think a more thoughtful, well-staffed mechanism or part of the court would be better.
Great, thank you. Dr. McConico, how about your thoughts?
Yeah, just like Director Impranato has mentioned, we have had to quickly shift and think about more intentional ways to provide telehealth and thinking about even video-based sessions for the families that we're working with, and have found that in some instances we've been able to engage more families and we've been able to expand our reach and our capacity. But we've also had to think very intentionally that for many survivors and for caregivers, that they may actually be in close proximity, if not living currently, with their partner who has been abusive or maybe is currently being abusive. And so having to really be mindful about the ways that we are having conversations and structuring those sessions. And I think that we as a program, as well as providers here at Boston Medical Center, have been more intentional around working more closely with our domestic violence program here, and being more intentional around doing some more universal screenings and just kind of providing universal education. And then lastly, I would say that many of our families are scared for a lot of different reasons, and particularly scared to come to a medical institution. And so for those of them who have younger kids or babies who are in need of well baby checks or who need those immunizations, and in some instances maybe they actually can't leave the house because they're scared or they're being prevented from leaving by their abusive partner. And so the pediatrics department here at the hospital has done something very amazing where they have a van that they can actually go to families, and they can do those well-child visits right there out of the van, and they can give those immunizations right there. And I think that has been something, again, just thinking a little bit creatively and outside of the box, and kind of how we can get folks the needed medical care that they need, how we can provide our services in a way that we're hoping is more safe for survivors.
Great, thank you. So I'm skimming the questions that are coming in from the audience, and it's now 1:54. I'm going to suggest we go about 5 minutes over so we can get to more of your questions. One question that is coming up is, what do we actually know about the statistics about the incidence of abuse during COVID? I might jump in and just say that there's very little solid research on this. There was a paper just published by some researchers from Brigham Young about increases in calls to crisis hotlines going up around the country by about 10%. And certainly, I could say anecdotally, a lot of friends in hospitals are reporting considerable spike in child abuse. One of the, and actually maybe I'll open it up if others of you are aware of any kind of systematic research. I just think it's early. It hasn't really been done yet.
I don't think we comment specifically on now. I have my thoughts about statistics. I know they have a purpose and they serve a purpose, but really thinking about when we talk about statistics, Mark Twain is credited with the quote that there are lies, damn lies in statistics. And I think it's really important because as we're talking about today, people have to recognize that what's being done to them is violence and that they deserve to have services and to be heard. And we know that there's a lot of things that prevent people from being able to do that. So we have to talk about who is actually being asked. And do they actually see what's being done to them as violent? And so I would say that statistics, in all honesty, aren't accurate, and I think we know that. So I get a little bit of nervous when we talk about statistics, because if they're not there, then people don't believe it's being done. And so I want to just sort of put that out there in addressing that question.
Yep, I think it's on it. Oh, go ahead.
Yeah, and I would just add to that conversation of that there are a lot of reasons why people, right, it's who's being asked the questions. And there's also a whole host of reasons why people don't necessarily disclose, right? And so we can think about, even before COVID, we've been talking a little bit about some of those racial inequities that exist and kind of what people, believe that might mean for them and their families if they were to disclose right now. And I would say that anecdotally, while there aren't, to my knowledge, there isn't a lot of research right now, or even, I think, data right now that lets us know exactly what is happening and kind of how much children may be put more at risk. But I would say I think that we could, based on past experience and what we know about any kind of crisis situation or a pandemic, my thought is that people aren't necessarily accessing, police. They're not reaching out to child protective services, or those reports aren't being made. But I would imagine that we will, several months or years out from this, that we will find that there was actually more violence that was happening, and that we will see those higher instances.
Yeah, I think it'd be pretty surprising if we didn't.
Yeah, and as I was saying, that we do have some anecdotal evidence that existing abuse may well be getting worse. And I know I work with a youth group here in Baltimore City, and adolescents particularly are feel like there's no way for them to get any help if they're being abused. But generally, from what some of our youth have said, is that it's not all of a sudden something their parents are all of a sudden hitting them, but that where there's been a lot of conflict and problems before, that seems to be exacerbated now with everything that's going on. Like you said, Janet, in terms of there's a little bit of data here and there, but it depends on localities, and there's local domestic violence hotlines, and then there's the national domestic violence hotline. And I kind of agree, I'm a researcher, but I kind of agree, like, we don't know for sure exactly what's happening and by how much, but we do need to allow for that. One of the things we're telling our healthcare providers with telemedicine, it's really important to continue to do that routine screening for domestic violence. But one of the things to do for safety, simple safety, just ask who the woman you're talking to get whatever earphones she uses to music. Doesn't have to be anything fancy, but just whatever she listens to, you know, whatever she uses to listen to music. And then you can ask her yes, no questions. And if somebody comes into the room or somebody's monitoring her, they don't have to know what they're asking. So, you know, you can say, are you being abused? Do you want me to call 911 with you now? You know, those kinds of things. And we need to think about how do we reach out to adolescents?
Yeah, I think that's,
you know, abuse.
That's great. Yeah. I'm seeing one here. This probably for Judge Dubose, but maybe for any of you. In light of all the protests currently happening, has there been a decreased police response rate for domestic violence calls? Does anybody know?
Thank you. I'm happy to weigh in. We haven't seen that here in Rhode Island. I do know, you know, it's tough with the numbers because in the civil, like I said, in court, we're open for business for just domestic cases on our civil calendar. Those are the only cases that we're hearing. So it appears when I come in and I'm taking the bench, it's nothing but domestics. And the same thing with driving while intoxicated. I think that police officers were very hesitant to go into homes in the early days of COVID because of their own kind of personal safety and not feeling they had the protective gear. Most police departments understand the limitations to the civil protective order. So if there's probable cause to actually make an arrest that will lead to no contact order being put in place, those police departments are going to use that vehicle. They're going to use that device. I don't see any nexus or connection between the protests and police response.
And there is some reports that some police jurisdictions are arresting only for violent crime. There's sort of like they have to have seen evidence of violence, which can be really problematic. But, you know, different police jurisdictions are doing different things.
Yep. Seeing some questions, a lot of how can I help or people of my profession help? So questions from pharmacists, questions from teachers who are normally mandated reporters but now are not seeing children. Any thoughts about other professionals who might be able to step in and have an impact to help identify or protect people?
Again, I think it depends on, I mean, I know our teachers here in Baltimore City are trying to be very alert for their students, you know, having issues, not being on the Zoom call. And then of course, we've got 20% of our students in Baltimore don't have access to any kind of internet or tablet or anything. So, you know, there's that issue in terms of if somebody never comes to class virtually, if they haven't heard from that student, to be sure to reach out to them and try and figure out a way to find out what's happening at home, because those are the kids I really worry about.
Yeah. And one last question before we close, and this one This one captures so much, so I'm just going to read it from an anonymous attendee. When so much outrage has been unleashed because of the video of George Floyd's death, how will abuse that goes on behind closed doors ever spark public outrage and a call to change systemic gender-based violence? That's the big one, but I'd welcome your thoughts on it.
I'm happy to weigh in. It's a brilliant question, and it's funny when folks come into court and they want to be heard, and we're having a hearing, for example, and lots of times the complaining witness will have on her phone, a bunch of text messages and videos and all of these things that to kind of to make the case. But what the court isn't equipped to yet is to figure out a way to accurately capture that material and publish it in court in a way. These are open proceedings, these aren't closed proceedings, so the public would have access to this information. And I think if the public could read some of the text messages that we read in court, or see some of the, not just the photos that police officers take, but the videos that are on the phone of complaining witnesses of actual abuse, it's a scary thing to do, and it's scary for them to come into court and to publish that to the judge, and having to show those to the defendant. But if there was a way to publish that material, obviously with the complaining witness permission, if they knew that this hearing is going to be recorded, this is going to be streamed through YouTube, and what you're showing this court is public access, that may be a way to get that material out. I can tell you that the material is there, but it's a brilliant question in that there's no way to get it out there other than self-disclosure, or again, if you're in a court and you're in open proceedings, and then we do a better job with publishing that material, not just to juries and juries trials, but to publish it in court and judges are making decisions, could be a really powerful tool.
Oh, that's really fascinating. Whether our cell phones could actually be a tool in the private realm as it has been in the public realm. Yeah. Any other thoughts? All right then. Well, I want to thank.
The only thing I would want to say is we have to think hard about how racism intersects with gender, and how Black women who are abused are continually portrayed as different. And anybody that didn't see 60 Minutes last night, take a look. I think that that's an important piece of the conversation.
Great. Thank you. I'm going to go watch 60 Minutes. I want to thank the four of you, Jacqueline, Sharon, Nina, and Melissa, for participating in this program and for your very thoughtful presentations and your perspectives, and especially for the critical work you do every day. Here we are brainstorming about solutions, but you guys are all part of the solution already. I also want to thank our audience for your terrific questions. In addition to the resources listed, there's a more extensive list available on the webpage for this event at radcliffe.harvard.edu. You just scroll to the bottom of the page below the speaker bios. I also want to let you know a recording of this webinar will be available on the Radcliffe website in about a week or two. I hope you'll be able to join us for Radcliffe's next virtual program, Decarceration and Community, COVID-19 and Beyond, Part 1, on Thursday, June 11th at 1 p.m. Further information about this program and others can be found on Radcliffe's website, radcliffe.harvard.edu. Thank you again to our panelists and to our audience, and we hope to see you then. Bye.